Increasing number of people have to live and work within a confined space, a basic premise which constantly calls for the accurate weighing of many contradictory interests. The process of project development cannot be separated from the changes in certain social patterns now taking place in densely populated areas of the world. They put heavy constraints on all planning activities, especially in countries which are improving their society and the various facilities, such as industry, housing, healthcare, and so on. The procedure of calling in a number of consultants and planners in the initial development phase and then presenting the resulting blueprint to a contractor for further implementation no longer fits in with today's dynamic evolution. When applying this conservative method, the lack of sufficient coordination between the many aspects of planning and building will inevitably lead to a less effective project concept, to longer construction delays, and therefore higher and less productive investments. These circumstances have prompted the Wilma Group to make comprehensive turnkey project development the nucleus of its activities. This method of coordinated project development, as practiced by our group, is the result of a long-standing experience in planning and building very extensive and intricately structured projects of a very diversified nature. Here, the key words are integration and coordination. Backed up by efficient planning and preparation, a project will be built well within the constraints and limits determined in the initial time schedules and budgets. Comprehensive turnkey project development is the only guarantee of optimum project planning and implementation, and as such, the most efficient way to reach the targets set by the client. It's the only way to respect both the client's specifications and budgets, and at the same time maintain the necessary flexibility in the planning and building stage of a project. Wilma turnkey project development means functional planning, controlled investment level, shorter building time, and optimum project quality. One of the Wilma Group's main specializations is the development of healthcare projects. Over the past years, a large number of projects, such as hospitals, psychiatric institutions, and nursing homes have been built, while plans for many new establishments are currently being developed. Generally speaking, turnkey project development in the healthcare field can be summarized as follows. If necessary, an extensive study of the present and future requirements for healthcare services in the surrounding area is made in the first place. If the client and the authorities concerned basically agree with this concept, a detailed program of requirements is drawn up. This includes, amongst others, an analysis of the traffic situation, organizational and functional setup, and may even contain site proposals. As soon as the first initiative for building a facility has been born, the administration of the Institute has to apply for a permit from the Minister of Health to start the building procedures, programming, design, specifications and estimating, and realization. After this permit has been obtained, the Institute is allowed to spend money for developing the different procedures and to engage the building associates. The result of every procedure has to be approved by the minister before money can be spent for the next step. It's here that the Wilma organization contributes its skill and efficiency in advising the administration in dealing with the procedures from the first initiative up to and including realization. Based on the demands and requirements of the region, Wilma starts the procedure by drawing up an inventory of the needs in the part of the country concerned. Population figures, epidemiological image, and information on existing institutions in the region are used to outline the facilities that may be planned in the region. After the consent of all parties involved, Wilma can figure out the more detailed program of the planned facilities in square meters, cubic meters, and total costs of investment. Whether it's concerning a big hospital or a smaller nursing home, the programming is based on the requirements of the medical and nursing approach in the institution to be developed. First estimates include the costs of building, technical equipment, and engineering, as well as rough figures of medical equipment, furniture, and so on. The program, together with the estimates and a rough sketch of the structure plan, form the basis for further development. In this stage, Wilma engages architects and other advisors to work out the structure's scheme to a definite design, which has to have the consent of the principal and then the authorities. This design has to be accompanied by more exact estimates, which have to be kept within the limits of the earlier figures based on the program. Only changes in the program may cause differences in these figures. Also, details are given of the first mechanical and electrical engineering programs, taking into consideration the possible effect of medical equipment on the technical installations, as there are X-ray departments, operating theatres, laboratories, intensive care units, and so on. When the consent of the principal and authorities has been obtained, Wilma, together with its advisors, will work out the design in further specifications and estimates as a basis for the realization of the projects. In this stage, the know-how of Wilma, which has at its disposal specialists and disciplines regularly dealing with healthcare building techniques, is fundamental to the quality of the institutions to be built. Technical specifications of building and engineering have to be drawn up, together with fixed financial figures answering to the estimates in earlier stages. There are not only the technical aspects to consider, but also the aspects of infrastructure, medical equipment, housing, and teaching facilities for the nursing staff, and so on. The last stage of development is the realization of the planned institute, fitting into the regional program. This stage also requires the consent of the Department of Health. There's no need to explain the activities on the building site, the organisation of which is daily practice for the Wilma Group. More important seems the support to solve the various problems of the principal and his staff, dealing with the organisation, selection and training of the staff and other healthcare professionals, the inventory of the necessary equipment, purchase procedures, and assembling the equipment in the hospital. These activities have to be carefully planned and executed to deliver the facility in the time agreed on. Wilma is used to advise the principal and his staff to come to the many detailed decisions needed to make a smooth execution of the plans possible. Wilma can also take part in these activities, for example, the purchasing and assembling of the medical equipment. All the activities required in the following stages are initiated and coordinated by Wilma. Thus, it's possible to realize a healthcare facility in a turnkey construction. In order to achieve optimal functioning of the project after delivery, it often appeared to be useful to call upon the consulting service provided by the Wilma Group in the beginning phase of the project. This special assignment is the responsibility of a team which has effectively contributed to the organizational and operational setup of the project. Once this project has been handed over, ready for use, the client can look back upon a fruitful period of time well spent, marked by optimum project management and all beneficial aspects related thereto. Although this impression of the possibilities of the Wilma Group in the field of healthcare doesn't pretend to be complete, it shows that Wilma is able to deal with a wide variety of activities in the continuing stages of development. The Dutch circumstances may be different from the Malaysian situation, but the objectives of both countries as to providing optimal health care for their population show much similarity. The difference is perhaps that the long experience in Holland with healthcare planning and modern approach of the medical and nursing care has led to the fulfillment of nearly all the needs in our country, besides the substitution of old facilities. In Malaysia, however, there are still ambitious new plans to be carried out. Dutch experience and know-how might be of great help, especially regarding the detailed filling in of the important Fourth Malaysian programme. In the last years, Wilma has developed and built several facilities of health care, among them 3 hospitals, 3 nursing homes, 3 psychiatric hospitals, 2 district health offices, and 3 institutes for the disabled. Even the development of training facilities for the paramedical professions is an activity which can be trusted to the Wilma organization. The up-to-date experience with these projects and the know-how of the Wilma Group must therefore be of value for the Malaysian efforts to bring its healthcare onto the highest possible level.